Hey there, welcome back in our Ask the Doctor segment. Today we're talking about men's health. Birmingham Medical News helping provide our expert today. Dr. Brian Christine is from Urology Ceners of Alabama, and he's here to take your phone calls at 741-7474. Dr. Christine, good to see you.
It's good to see you.
It's not an easy topic to talk about with anyone's health. There are things that you're embarrassed about, you don't want to talk about, but it's so important, and that's why you're here to kind of encourage men, if they have questions about things, to ask those questions.
No, absolutely. We know that women are very vocal about their health issues, and men could certainly learn from that example. Sometimes men don't want to talk about those issues. Sometimes men are a bit shy, so a forum like this may be good.
What's the most common thing that you deal with when?
My area of specialty in urology really deals with erectile dysfunction and male incontinence or continence, urinary issues, and that's really where I concentrate my practice.
All right, well, let's go to George, I believe, is on the line now. George, you there?
Yes, I am.
Hey, George, what's your question for Dr. Christine?
My question is that I've been diagnosed with prostate cancer, and I am on hormone therapy. And I have a two-part question. What are some of the long-term effects of hormone therapy, and will this reduce my PSA count?
Okay, well, that's a very good question. Thank you for taking the time to call in, George. Let's answer the second part of your question first. You're on hormone therapy for your prostate cancer. Hopefully it will reduce your PSA. It oftentimes does reduce your PSA, and that's the goal, to try to lower that PSA, because if the PSA is lowering, then what that tells us is that your prostate cancer should be slowing down. We're trying to get it under control. So that's the answer to the second part of the question.
Okay.
First part of the question, are there side effects? And there certainly can be. We know that the reason we use hormonal treatment in men with prostate cancer is that we're trying to lower their testosterone. Testosterone can cause prostate cancer to grow more rapidly. And so the hormone therapy will lower the testosterone, and if you lower a man's testosterone, there can be side effects. Some men will say they don't have as much desire for intimacy. They may say they don't have as much energy. There can be muscle loss or bone loss. So there can be side effects to hormone therapy. Overall, hormone therapy can be very beneficial, so you need to follow up closely with your urologist to make sure those side effects aren't becoming too much of a problem.
All right, George, thanks so much. I hope that helps you, and good luck with your medical care. I will say on the outset, as we get some more calls in, this is a midday program, and it's a G-rated program, and this is obviously a topic that we could go down roads that it's not appropriate for us to talk about. But because, I will say that because if people have questions, and some of our callers, if they don't get through because their questions may be a little bit too much, then you would encourage them to do what? Absolutely.
If they have questions perhaps they don't feel comfortable asking or we can't get to today, they should call the office at Urology Ceners of Alabama. They should call 445-0180.
I mean, so can you answer questions for them over the phone?
Oh, absolutely. We can talk over the phone. We can make an appointment for a man to come in, or for a woman to come in for that matter if they need. We're happy to do that.
All right, you mentioned intimacy issues, and I think a lot of women may have questions that they want to ask regarding their husband, and we're not going to get into all that here, but that would be something that you could talk with a woman over the phone, right? All right, Phil is in Homewood. Let's see what Phil has to say. Phil, go ahead.
Hi.
Hi.
I have Peyronie's disease, and my father had it, and my older brother had it, and now I have it. And of course, when you look it up on the internet and you start doing research, they say they really don't know what causes it. It obviously seems to me to be, passed from generation to generation. And is there any treatment or anything out there available for people who have this? And I'm 56 years old, and
Well,
Phil, let's let the doctor see if we can get to it.
Phil, we're glad that you called in. Peyronie's disease, one of those issues that deal specifically with men's health issues and intimacy issues, is a very important subject matter. We know there are a lot of men out there who have Peyronie's disease that don't talk about it. There really are very effective treatment options, and the best way to evaluate that is to have you come on in, make an appointment to come see me. Again, because of what I specialize in, Peyronie's disease is one of the things I treat virtually on a daily basis. There are good treatment options. There are surgical treatments, non-surgical treatments. It's a very rare man that we can't help, and help significantly with Peyronie's disease. So certainly give a call and come on in.
It sounds like a lot of men will deal with whatever their problem is in secret because they're either embarrassed or they think there's no help for them, when they really don't have to be living all this time with this, right?
Absolutely. I mean, there's no question, again, as I said before, that women can be very vocal about their health issues, which is a real positive. Men sometimes not as much. They'll be quiet. They may not talk about it. But the only way to get treatment is to come forward and talk about it and meet with a qualified doctor. So we want them to do that.
All right, Dr. Brian Christine, again, is from Urology Ceners of Alabama. And where are you located?
So we have offices around the city. Our main office is in Homewood on Independence Drive, but we have satellite offices at virtually every hospital in the city.
All right, if you want to ask some more questions, feel free to get in contact with their office.
Thank you so much.
Thank you so much. I appreciate you coming.